Yeah,
Yes,
ma'am,
yes.
we are on live, ma'am. Yeah. So very good evening, doctors. I'm Dr. Stalin on behalf of Shield Healthcare, welcoming you all for today's program. So we have a interesting conversation session today, and the topic is CA breast. So I would like to welcome all the participants. I would like to welcome the audience who have joined through our online mode, and I would like to welcome Dr. Uh, Ritu Satwani, ma'am. Madam has needs no introduction. Madam has done her MBBS, MD, FICOG, FIAOG, AMRCOG, and AIT training from Singapore. Madam is currently a well-known obstetrician gynecologist, sexologist, cosmetologist, and infertility specialist. Madam is the founder and CEO of 360-degree Healthcare Studio, Director Shyamwell Women Clinic and PTBC, co-founder mom, and madam is also the board member of WSCG. Welcome, ma'am, and I would
Thank
like to
you.
welcome Dr. Shashibala Bonsale Sau, ma'am. Madam has done her MS FICOG. Madam is currently the president of Gwalior OG Society, and madam has done her MS OG from GRMC Gwalior, and madam is currently the consultant gynecologist in public health department and uh, family welfare MP government, working as obstetrician gynecologist specialist in public health and family welfare, and secretary Gwalior Obstetrics and Gynecology Society from 2020 to 21, West Zone Coordinator Breast Committee Fox 2020-21, and madam is the member of IEA EC Committee Fox.
Dr. Stalin, sorry to interrupt you. The program is not going live on the YouTube. I have received so many messages. Sahiti, please check and please again introduce madam. Huh?
Okay.
1 second.
Madam, sorry for the inconvenience.
No. You show my slides also, Ritu. Yeah.
Ma'am, slides we are not showing. We are doing only question answers. Huh? You have changed
Okay,
the format.
fine.
Yeah.
Ma'am,
Okay.
it's coming live, ma'am. Once.
It's coming. Just a second. I will check. It's coming live.
Yes,
Just a
ma'am.
second, Sahiti. Just wait, huh? Because I received so many messages. Huh? Yeah, it's coming. It's
Ma'am,
coming.
it's live, ma'am. Yeah, ma'am, it's coming.
Yeah, now it's coming. Yeah. Please
So,
introduce our icon again. Yeah.
So I would like to welcome today's icons, Dr. Shashibala Bonsale Sau, ma'am. Madam has done her MS FICOG. Madam is currently the president Gwalior OG Society, and madam has done her MS from MSOG from GRMC Gwalior. Madam is currently consultant gynecologist in public health department and family welfare of government of Madhya Pradesh. And madam is the secretary of Gwalior OG Society from 2020 to 21. Madam was the West Zone Coordinator, Breast Committee, FOGS 2020-21. Member IAEC Committee, FOXY 2021-22. Working as Coordinator, IAEC Committee, Raj Yog Foxy. Worked as in charge at Mercy Home under Gwalior Mansik. And Director at Fight Back Warriors, dedicated to women empowerment through women self-defense. Co-founder and in-house medical advisor for maternity wellness firm, just conceived, founded in 2019. And madam was also the member secretary for empowerment NGO partner, member IMA IFS. So with this short introduction, I welcome you, ma'am. I'm handing session to for your further proceedings. Yes.
Yeah. Thank you, Dr. Stalin, and thank you, Shield Connect, for providing the platform for this program. So, hello everyone. A warm welcome to this series, the Icons in Conversation with Dr. Ritu. So I've seen that some of my friends have joined all across the globe. So welcome all my dear friends. So friends, as all of you are aware that at this program series every Thursday, 8:30 p.m. Indian Standard Time, I am here in the conversation with one of the icon who has done an enormous work in the field. So today's icon is none other than my favorite Dr. Pam madam. Madam and my connection is from last so many years. I can say इसको हिंदी में मैं एक वर्ड बोलूंगी, इसको बोलते हैं जिसका रूह से रिश्ता होना. So we are very thankful to the madam that in spite of having her busy schedule, madam has taken out the time for our session, and today the madam is going to give us some highlighting about the breast cancer. So friends, as all of you requested, today we are changing the format of program. Like the earlier program, the Pundit and Dr. Ritu show was super hit. So today again we are changing the program and we have become today we are going as a question answer session. So first I am going to start with some conversation with the madam. Later on, if there are any questions, please do feel free to write in the chat box. Once our conversation is finished, then we can take whatever the live questions we have received. So once again, a very, very warm welcome, Shashibala madam. Warm welcome.
Thank you, Ritu. I'm deeply honored to be here. Just a ripple is needed for the big wave, and you have given that platform to me. Efforts to update our knowledge always helps in ameliorating pain. We deal with women. So let's join hands and save every woman. That's my message for today. And let's start the program on that note. Yes, over to you.
Thank you, madam. Thank you so much. So friends, as all of you are aware, the topic of today is the breast cancer. So we will start from basic to advanced questions. So madam, my first question to you, what is breast cancer?
See, this is the basic we all must know. We know breast, we know cancer. So breast cancer is the cancer of the breast. So when normal breast cells multiply, then abnormally, see, cancer, we always say when abnormal multiplication is there, undifferentiated cells, same way in the breast also, when they multiply, we get breast cancer. And this breast cancer, they spread to different parts of the body as metastasis via lymphatics. So breast cancer is not to be brushed under the carpet. It is here to stay and we must be aware of it.
Very true. Yeah, yes. Thank you, madam. Thank you so much. Madam, as you have just explained us, madam, please enumerate what are the risk factors for this breast cancer and how it presents.
See, risk factors are many, and risk factors, you can club them as avoidable and unavoidable. So unavoidable factors can be being a female. You can't help it. You are being a female. You have every possibility of getting breast cancer. But being an active female, being an aware female, see, because obesity and all these are avoidable. Being female is not avoidable. So we have to see it in that sense. You be a woman, you be a beautiful woman, you be an active woman, you swing your arms, you do everything, and you do breast examination every time. So being female is one. Secondly, we have age factor. So age is also very important, but age again, you have no control over age. So the cumulative effect of hormones. See, if you get early menarche, you are exposed to hormones at a very, very early age. And if you get a delayed menopause, again, you are exposed to hormones for a longer time. So cumulative effect of hormones also works on the age of the female. So from 30 years to 70 years, you are in that range where you can get breast cancer because of the hormones. So getting early menarche, but getting married, see, how can you avoid these hormonal cumulative effects? By getting married, by getting pregnant, by breastfeeding. So it's very simple. You just give a gaps to that cumulative effect of hormones. So get married early. You are all are pursuing careers. I know you all will say, madam, career is there, but career apart, your nature's call is also there. You have to listen to the nature. And once you get pregnant also, you have to breastfeed your child also because of the lactation also that protects. So these are some of the factors which we cannot control. Also, heredity is not in our hands. So what to do? If you have a family history and you have a strong family history of breast cancer in your family, then you must be aware and get gene savvy. You have to get gene savvy. Not only getting savvy academically, you have to take care of yourself. So that can be there. Now, as you said about...
Yes. Yeah, thank you, madam. You have given a very, very important message as we all know, and we all gynacs are promoting for the breastfeeding, that breastfeeding is one of the protective factor from the breast cancer.
Yes.
We all are promoting and telling everyone. So these days, in everyone's and each one's OPD, we are getting the youngsters who are saying, no, we are not ready for the breastfeeding, ma'am, our figure will disturb. So
Yes.
these all are the myths. We all are promoting again and again for the breastfeeding. So thank you, madam, for highlighting this very, very important point. So madam, as you told,
One more point,
yeah,
Ritu, I would like to stress this factors which can be controlled. Obesity,
Yeah.
everybody can control. See,
yeah,
revolutionize your eating, sleeping, and sitting. When you are sitting in an office, just take a walk around after every 20 minutes. More walking than sitting. So eating right, eat veggies. I won't ask you everybody to go green, but you can eat veggies because red meat and red wine, they are said to be little. I was talking to Tata Memorial head Dr. Badwe. So he said red meat and red wine, these two are things which have to be tapered or you just cut down because they are more prone for that if you have those eating habits. So develop a taste and also sleeping. See, everybody's on the mobile, sleep hours are erratic. So that REM sleep gets disturbed. So that fat loads, melatonin, we all know all about it. All doctors know about it. But the general public, it should be stressed that catch your sleep early, get up in the morning. So having a taste. And one more factor, alcohol, I find nowadays girls, they think it's a done thing to have alcohol, to do smoking. But smoking, alcohol, they are a big no-no for this because alcohol and they are the factors, predisposing factors for this. So they can be avoided. Self-indulgence is okay, but you have to be balance it with your outdoor activities and go in moderation. I won't say, but you can go in moderation for that. And laughing wholeheartedly, why brood? Everybody is coming with that baggage. So that stress also is a very big predisposing factor for obesity and this breast cancer and radiation, as you all know, it has to be avoided. So these are the factors. They are very, very pertinent. You cannot just push them and it's okay, right?
Yeah, very true, madam. Thank you so much. I am able to see Anil Kaur madam has joined. Yeah, welcome, madam, to my show. And I'm able to see.
She is my icon.
Yeah.
She is my icon.
Great. Welcome, madam. Welcome. I'm able to see Geeta Khanna madam has also joined from all the way from the Lucknow. Welcome, madam. Welcome. So, as madam has very clearly pointed out regarding the smoking and alcohol, here I want to add plus the addition of the excessive caffeine intake. These days in the metro cities, we are getting the patients who are telling, ma'am, हम तो शक्कर चाय नहीं पीते ज़्यादा, कॉफी नहीं पीते, पर हम तो खाली diet coke पीते हैं. So friends, that diet coke is also having a more caffeine compared to the normal. So this is the one point I want to add. Yeah, thank you, madam, for highlighting these points. So I think every one of us getting the patients of the breast cancer or the breast cancer screening. So many patients are coming to asking the questions. Ma'am, please suggest us regarding what is the screening schedule.
See, first you must know who needs screening. So that history is very important. In every field of our medicine, history is very important. So whenever a patient comes to you for a lump, if she has diagnosed it and she has come to you, it's easy for you. Then take a detailed history. Take a past medical history of if she has had any benign breast diseases or she has had any breast cancer or radiation in any form or family history, first degree relatives or past surgical history of breast biopsies, lumpectomies, mastectomy or oophorectomies. So general history, whether she is losing weight. So all these are the candidates who have to go in for the screening. So this when you do screening, there are three methods. Most commonly, we are doing mammography and we are doing this ultrasound, sonomammography, and we are doing MRI. But before that, which every woman can do is self-breast examination. So self-breast examination is a very, very important screening schedule. And since suppose that you are an average risk patient, you have no family history, no first degree relatives. So after 30 years, self-breast examination every month, post-menstrually, 5th day. Why? Because post-menstrually? Because that time the breast is soft and it is very easy to palpate with the flat of your hand. You can see the lump. And after 40 years till 70 years, see, I'm talking about the average risk. You do mammography every yearly, right? But if the patient says she's high risk, she has a family history, then after 30 years, every 6 monthly, we are advocating so that we catch them young. We catch them in the initial stages only, because breast cancer is supposed to be the best cancer. It is in your hands. You palpate yourself and you diagnose, you go to a doctor, doctors are there, modalities are there. So it is lies. So you have to be aware of your breast. Breast is not only a decorative organ. It can be very, very, it's a big, big culprit, and you have to palpate it yourself. So that is the screening schedule, as I said, for mammography. But for mammography, so many people come to us with mammography reports. Madam, BIRADS 0 hai. So BIRADS 0 needs additional imaging. It is not first degree. First degree is negative. BIRADS 1 is negative, but BIRADS 0 needs additional imaging because it has not given a definitive diagnosis. Maybe the breast is dense, so that the radiologist has given the impression it is 0. So you again send her for next. 2, if it comes to 2, see, we only see the mammography reports. There's a lump in the breast, fibroadenoma, and we just tell the patient to go away. But if it is 2, then it is benign. If it is 3, probably benign, but short interval follow-up, and we call her after 6 months, okay, to repeat the mammography. BIRADS 4, you remember 4 is suspicious. BIRADS 4 needs tissue diagnosis. You must advise. I believe all doctors are here, so I would expect my doctor friends, whenever you see a BIRADS 4 category told by the radiologist, you send her for tissue diagnosis. And BIRADS 5 is highly suspicious. And BIRADS 6 is known. It needs surgical excision, and you catch her, because we have lost one patient, a young girl, and we thought it is just a fibroadenosis. And Dr. Meenu Walia had come from Max. She was telling about her. She said because of the doctor's negligence, that doctor thought it is such a young girl, 23-year-old, how will she get that? But so BIRADS category, please pay attention to mammography reports. Mammography is not only fibroadenosis, mammography is more than that. Okay?
Yeah, very true. Thank you, madam, for such a clear-cut explanation. I think a lot of us is having some confusion for the BIRADS category. So madam has explained very nicely. Thank you, madam, once again. Ma'am, so in which category of the patients we have to advise for the breast MRI?
See, breast MRI indications, it is a preventive care. When BRCA1, BRCA2 positive women and other high-risk patients, it is better to do a preventive care. We do it MRI. So not to leave anything to chance. And preoperative staging also, whenever we want to do a staging, in newly diagnosed tumor, primarily infiltrating the lobular carcinoma. See, ductal and lobular. Ductal is very slow. Lobular is quite fast. So preoperative staging in infiltrating lobular carcinoma. Or if you have a susceptible residual breast cancer after surgery. After surgery also, there can be a residual breast cancer. And unknown primary source, if you have an unknown primary source, negative mammography and sonography, but you feel there can be cancer, advise her MRI. MRI is soft tissue. It will tell you everything about the soft tissue, underlying tissue, everything. And fifth, one more we can add on, that is susceptible breast cancer in patients with breast implants. So now this breast implants, you come across so many. So whenever patients tell you about breast implants, they are susceptible for breast cancer. So MRI helps in those also.
Yeah.
Right?
Thank you. Yeah, very right, ma'am. Ma'am, besides that, these days we are seeing some patients, some male patients also. So many male patients are also coming with the history or the CA breast. What you say about that?
So the gynecomastia we used to read in our college time, but this male breast is also very susceptible. We see all male, same factors are there. Obesity is there, alcohol is there, and no activity of the hands. Mostly the upper limbs are always, you don't even raise your arms, so that lymphatic drainage is impeded. So even if they don't have that mammary gland active, but still that rudimentary mammal, they are mammals, so they have that. So in that case also, the course of action is same, MRI, and MRI helps in those male patients.
Yeah.
Right?
Yeah. Thank you, madam. Thank you so much. Now coming to the management. So, ma'am, I want that you please elaborate the management for the young females and in the pregnant females also, and in the lactating mothers also.
Yeah. This is one thing. 10% of young girls we are seeing who are not married. As I just said, that girl was missed, as Minu Walia was saying from Max. She has come from Delhi and she emphasized this. So whenever a young girl comes to you, you must always keep, ignorance is not always bliss. You must keep it in mind. So if it is in your mind, you will always recollect. 10% of young girls not married or recently married or not who have not completed their family, they can get breast cancer. Then again, that multidisciplinary approach we have to take. Oncologist, of course, it should be there. A gynecologist, patient, and if she's married, her husband. Fertility concerns are very much in these patients. Will I get pregnant? Will I be able to lactate? And she's depressed, and she feels that this is the end of the road for her. So fertility conservation in these patients must be kept in mind. And chemotherapy, that is gonadotoxic. So if you give chemotherapy, she will get menopause, that ovaries gets all that because of the toxicity. So it is a gonadotoxic. So they become infertile or subfertile for little time. So oocyte preservation for these patients and embryo cryopreservation, that should be advised. And a team of oncologists, gynecologists, and she should be taken into confidence along with her husband. And if she's unmarried, then her parents.
Yeah.
So this stress is there. Yeah.
Now, thank
you. Ritu, you told me about delivery also, right?
Yeah.
Now we are getting patient. She's already pregnant. What do you do when you diagnose a patient of breast carcinoma and she's already early first trimester? Say she's in first trimester, and this is a very vulnerable group because detection is delayed. Nowadays, we tell you must palpate the breast, prepare the breast in the ANC checkups only. But the detection is delayed. They're coming to us in 3rd month, 4th month. Treatment is delayed. Most vulnerable to get silly advice from so many people. Arey, ye to pregnancy mein aisa hota hai. This lump to uska hai. See, after 5th month, the breast gets active in pregnancy. So, breast preparation is only after 5th month. Before that, if there is a lump in the breast, then you have to get a USG. USG is very safe in pregnancy. You get a USG of the breast. And if suspicious, then mammography can be done, but with a shield. And one more thing, since we are talking about shield, whenever you get a mammography, you must get a thyroid shield also to save your thyroids. Because of mammography, we are exposing our thyroids also to radiation. So when a patient is pregnant and she's advised mammography, get a shield to protect the baby. If suspicious, now we feel, yes, this is a danger case, then we can do a true cut biopsy. FNAC will miss. So don't go in for FNAC, true cut biopsy. Send the product for histopathology. And if a cancer is there, offer her the treatment plan. She might have to terminate the pregnancy if it is very early. Because early pregnancy breast cancer, you have to discuss, inform the patient all the possibilities, and let make her a party to decide with her what to do. So this early pregnancy, it's better to diagnose. And if you are diagnosed, you are a very intelligent doctor, I must say. But if she comes in late pregnancy and the termination is not possible and she has crossed the viability, then wait for delivery. It's better to wait for delivery. At least she has a baby in hand. Treatment is again 3 modalities are there. We all know: surgery, radio, and chemo. Surgery is safe in all trimesters. Surgery is very safe for breast cancer. And we are happy to say that in breast cancer, surgery has conservative surgery is there, radical surgery is there. So many modalities of surgery is also there, and it is very safe. So we can do anything. We can do lumpectomy can be done at that time. Don't go for but reconstructive surgery at that time. People are in a hurry to get reconstructive surgery also done. So get surgery done, deliver the baby, have a viable baby, then she can be put on chemotherapeutic agents, and lactation should be delayed because this contraindication, tamoxifen, and we always, after breast cancer, what do? We give them, they are E2, P2 dependent. So we give them tamoxifen or Herceptin. But drugs like tamoxifen, Herceptin, they are contraindicated in pregnancy and lactation. So better not to give these drugs. Okay. Now, I think that will,
Yes,
you have to take
yes.
her into confidence.
Yes,
Okay.
yes, very true, very true. Yeah. Yeah, thank you, madam. As madam has clear-cut pointed out, these days the true-cut biopsy is of choice, not the FNAC. So this is very much cleared with the oncologist also. So thank you, madam, for highlighting this point. This is very, very important. Ma'am, now coming to a question which we see so many patients in our OPD. Sometimes the patient has given the history, madam, I had operated for the breast cancer. After that, I had pregnancy. Now I want the contraception. So what contraceptive we can give? Which is the drug of choice?
See, after delivery, the patient of breast cancer is put on contraception for 2 years. At least for 2 years, she has to. She should not take hormonal contraception. This you remember. As this cancer is hormone receptive. So just straight away, don't give her say, I've seen in government hospitals, I have worked with them. They don't know the ABC of hormones and they're just prescribing. So even if you have a case of breast cancer, do not prescribe hormonal contraceptives. Most of the recurrences occur within the first 3 years, but they can occur up to 10 years. So contraception is very important. So again, before contraception, you must get also an echocardiography done of this. So anthracycline is highly cardiotoxic agent and it causes cardiomegaly. So that ejection ventricular fraction, we call that, now we see in the echo. So that is getting reduced. So the team of doctors again give a green signal that she can plan a next pregnancy only after doing an echo. So if the patient is on tamoxifen or letrozole, then these drugs are to be taken for 5 years. We just advise. But she might ask you, how long can she wait? So tell her to hold tamoxifen and then plan. So contraception should be mechanical. You can ask the husband to cooperate. Hormonal should not be given. Ask her to not to take tamoxifen and letrozole. Or if she's planning after 5 years, then take tamoxifen. Leave that tamoxifen after 5 years, then she can plan. So then after delivery, again, she can start the tamoxifen. Because you know why I'm telling you about tamoxifen? Tamoxifen causes endometrial hyperplasia. So she must be careful, right? And I have seen patients, instead of taking tamoxifen, what they do, they get oophorectomy done. So that is the best way. But here we are talking about contraception, so we won't talk about oophorectomy. I'm just saying, not to have people who have a great gene to have ovarian cancer also. So it's better to do, instead of doing hysterectomy, do lumpectomy and oophorectomy. So you save her from the recurrent cancer also. And that level of this goes. And this is this pertains to like 45 plus, 50 plus patients, right? So yes, tamoxifen, you hold on if she wants to plan pregnancy, and tamoxifen has to be done and given under follow-ups. So we do a regular follow-up when the patient is on. And contraception, no hormonal contraception, only mechanical that she can have. And there are so many things. Yeah.
Thank you, madam. Thank you so much for clearing so many doubts regarding the breast cancer. Friends, if there are any questions, you can put in the chat box. Dr. Stellin, are you able to see any questions?
Ma'am, just I'm waiting for the participants to post their queries.
Okay.
Ma'am, one question is like, ma'am, is there any physical findings suggesting breast cancer apart from the lump, this lump, ma'am?
Yes. I think I missed that point. Very thanks for reminding. Nipple discharge. Nipple discharge is very, very important. See, differential diagnosis you must do always for a lump in breast. So lump, as I said, it can be soft lump or it can be hard lump. So hard lump is more goes in favor of that. Apart from that, you must just by examination of the breast, skin over the breast and armpit is red. So it appears red, reddish, inflamed, and it is not tender. It is only tender when it is this inflammatory breast cancer. Okay. And you have seen an orange, that puckered skin is a clear-cut diagnosis that something is pushing. And the level of the nipples. See, whenever you examine a patient for breast cancer or breast lump, you must make her stand and see the level of the nipples are in the same level. If one of the nipple is ill-looking, puckered, pushed inside, one low, one high, then there is a doubt that there can be a breast cancer. And nipple discharge, bloody discharge, any discharge, please don't ignore. These are the warning signs. These anybody can, even the males. I must say the males should be cautious now because all cancers nowadays, I don't know, they have jumped and they're just after the mankind. So all males also, you must look at your nipples. Take time to take bath. You are in such a hurry, you just take a shower and rush. But you must every day, if not every day, weekly, you must check. And for girls, of course, monthly, they must see their nipples and their breasts. So lump, nipple discharge, puckering of the skin, and redness. These are the main important ones. Also, you can see skin, there is chest pain. Sometimes they say there is chest pain. So these are the first symptoms. So catch it young, catch it fast. That is 2A. If you catch this puckered skin and all, then it gets quite late because then it has spread. Okay. So incidence is increasing.
Yes. Ma'am, another one question is, what will be the survival rate of these breast cancers?
The survival rate has increased because of nowadays, it depends on the staging. So at what stage you have diagnosed the cancer. The first and second stage, the survival rate has increased because you can have so many things. MRI is there, then you have radiotherapy, you have chemotherapy. So detection is early. And if the patient comes in 3A, 3B, when already that lump has spread, so if she's complaining of chest pain, cough, then it has gone, secondaries and metastases have gone, then that time you have to be very, very cautious, and then that survival rate is less. So survival rate depends at what stage it is diagnosed.
Yes.
Very true.
At category.
Yeah, very true. Yeah. Thank you, madam. Thank you so much. Till we are getting some more questions. Madam, as you are aware, my show name is The Icons in Conversation with Dr. Ritu. So now we have covered a lot of academic questions. Now I'm going to ask you some non-academic questions. This will be a rapid fire round. So you have to answer in one word without taking much time. Huh? This is a surprise. This is a surprise. I never tell anyone about these questions. Huh? So, madam, your favorite color?
Red.
Okay, wow. You are a coffee or tea person?
Tea.
Tea, okay. Any of your childhood memory which you want to share with us? Childhood memory.
Childhood memory. I wanted to be extraordinary. I didn't want to be a doctor. I wanted to be something different. So my daddy gave me a different name. So I must say but the childhood memories only. This thing is, I used to sit on my daddy's lap and drive, and he gave me that confidence, so much confidence. Kitna acha horn bajaya. I only just blow the horn. So my confidence stems from my childhood. So I was never said not to do anything. I did whatever I felt like. So I thank my parents for that. And that is what I want for every girl, to bloom and to her full capacity. So don't run down. So I was very lucky. And that childhood memory is that of my daddy only. And he taught me driving. So I've been driving since 12, 13 years when I was that old. So no fear. I didn't gain much of height, but I did drive. So that's all I have to say.
Great. Ma'am,
Yeah.
is it your dream to become a doctor and especially a gynecologist?
No. I never wanted to be a doctor because I had seen my grandmother was a doctor. My bua was a doctor. My sisters are doctor. All are doctor from AIMS, Maulana, everywhere. They are all settled abroad because there were too many doctors in our family. So I was actually more into, I loved civics, social studies. We had in those times, we had social studies in schools. So civics and history. I was into history. And I got through in St. Stephen's also. And that was the first batch of St. Stephen's. I was a CBSE topper here in Gwalior. And I was the only one in Gwalior to get admission in St. Stephen's. But again, those daddy just said, Delhi is not safe. And my auntie who was the brigadier there, and her husband was there, they got transferred to Mumbai. So Mazgaon dock. So that time also, then I had to opt for what next best was. Being a doctor, I gave PMT and I got into medical. So here I am.
Okay. Yeah. And ma'am, your favorite destination where you have visited and again you would love to visit?
My favorite destination is Goa. I have built a retirement home there. So I'm waiting to get retired and go there. I love beaches.
Wow. That's great. Yes. And ma'am, which season you like? Winter, summer or rainy?
I like winters.
You like winters. Okay.
Because I like long coats.
Yeah, I was just going to say, Pam loves her long coats.
Yeah. And I have a dream to go with Anil to Goa and just have freak out.
But you can't wear a coat over there.
Then Goa, you don't need a coat. In Gwalior, when I stay here, I love winters. Yes.
When we have received one question, I'm taking that.
Yes, sure.
This program is going live on the YouTube also. So we get some audience across the globe.
Yeah, sure.
Yeah.
Yes.
This question is, sometimes the nipple discharge is seen in the perimenopausal age with normal prolactin levels. So how to proceed?
See, normal prolactin levels, they have no relation to nipple discharge and breast cancer. Galactoria, that is what we call, if the serum prolactin level is, we do not get serum prolactin levels done for nipple discharge. Nipple discharge itself, perimenopausal age, she's in the danger zone. The hormones are playing havoc with her. They are waxing and waning. This time, do not negate the possibility. Be suspicious. Get the discharge done. And nipple discharge is a very, very important. And if the patient gets a nipple discharge, she's a lucky female because it will get diagnosed early. See, lump sometimes you miss, but nipple discharge, nobody misses. They come to you. And serum prolactin level, galactoria normal, still it can be cancerous. Right?
Yeah. Thank you, madam. I'm able to see Renu Bhatia madam has joined. Madam, welcome Renu Bhatia madam, one of the stalwart from the Kanpur. Madam, before you wind off, because I think we are not having no more questions, your any message for the upcoming doctors?
See, when you get cancer, and I must tell you, I must share a secret with you because I'm not ashamed of that. You should not be ashamed of any scars. I had cancer when I was 44.
Oh.
I have myself suffered, but I don't call myself a survivor. I call myself a warrior. Because when I went to Tata Memorial, I saw 70-year-olds. They were suffering.
Yeah,
Yes.
Yeah.
So what happens to you is not in your hands, but you can control the way you handle it. If you have loved life before cancer, then penchant for life improves. You will love life after cancer. You will find beauty again because you know how life is worth it. Just don't while it away being a crybaby. Just live every moment. So I think I started living life only after 44. Because before that, I was studying, I was slogging, I was seeing patients, I was not sleeping, I was not eating properly. But now I pamper myself. So I got introduced to myself, introduced to my super being. Each one of us has the capacity to be a super female. So encountered so many of my qualities hitherto. I had unearthed my qualities which I didn't know existed. I became a writer, I became a singer, I became everything, a musician. So no option is there. Don't surrender. Arm yourself to fight and emerge victorious. I don't like crybabies. So anything can happen. See, this is a body. It has to decay. So in any ways it can decay, but you don't let it decay. Be cautious, be aware. And there you are. So don't you think cancer is a big threat nowadays? Each and every person, you hear so many people coming to you. I get so many professors and from the colleges, they come to me, madam, this I have suffered, and they are so depressed. I said, nothing to be depressed about. Best cancer is best cancer. And for that, every cancer, we have made strides into innovations, so much of chemotherapy, so much of nice doctors. The Tata Memorial doctors are real boon. And after meeting Meenu while you're from Delhi, I can say Delhi is also one of the best. So scary, soul scarring, septical scenario. Don't take it that way. Start home self-examination now. The tool is in your hand. So overwhelmed by life is very sweet. And thanks to our Anil, and we are attending Raj Yoga and all. So yoga is important. Vitamin D is important. Swing your arms, eat well, and just be friends. And just don't brood. Brooding it won't take you anywhere. You're wasting time brooding, right? Yeah. So that my message will be that live life. Life is too precious.
Very true. और जिंदगी तो एक बार ही मिलती है. Yeah.
Thank you. मिलती है.
Yes. So thank you, madam. Thank you once again from the bottom of my heart for accepting the invitation and sparing your time with us. So friends, with this, we are going to wind up session for the today. And thank you, Shield Connect, for providing the platform. Do stay tuned with me on every Thursday, 8:30 p.m. Next Thursday, 8:30 p.m. We are going to discuss about the atypical fibroids, how to operate, what are the difficulties we are getting while operating the fibroids in the atypical fibroids, broad ligament fibroids, cervical fibroids. So do stay tuned with me. On the next program will be on 7th July. So see you then. Till then, bye-bye. Good night.
Bye-bye. Good night. Thank you, Anil. Thank you, all my friends, for being there. Thank you, Ritu.
Yeah.
Good.
Welcome.
Thank you. Thank you, Shield Connect.
Yes, ma'am. Thank you, ma'am. Thank you very much, ma'am.
Bye, Dr.